Thank you, and I want to thank the organizers from day one for inviting me to speak with you today. And really, I've attended a number of the sessions and heard from a number of employers when they look to support their employees, when they look to recruit. One of the areas that also is important related to this is what benefits are offered through healthcare. But there's also an increasing issue to do with demands being placed on employers in terms of the cost of rising healthcare. So that's really what I want to talk a little bit about today, specifically highlighting this issue of cancer. We're seeing increase in the rates of cancer within the United States and really much of the world. So it's really going to be focusing a little bit of our talk on the issue to do with cancer in the workplace and how we can try to help support you as you work to support your employees and their families. Just a little bit about myself. So my name is Denise Harnois. I'm a hepatologist, so I specialize in the area of liver disease and in liver transplant. And within our group, I actually specialize within the treatment of liver cancer. I've been at the Mayo Clinic for more than 30 years, in fact, but working in the Mayo Clinic in Jacksonville, Florida for the last 25. So who is Mayo Clinic? Mayo Clinic has been around for 160 years. Most people, when they think about Mayo Clinic, they think about Mayo Clinic, Minnesota. But there's actually in the mid-1990s, or mid-1980s, the Mayo Clinic had satellite locations that were in Arizona and Florida, and we really often refer to it as one Mayo, three doors. It's really three unique organizations that are integrated and work together for the care of patients. We see 1.3 million patients each year. And really, it's an organization which works very hard to integrate all of the care for those patients. We're the #1 hospital in the United States and, in fact, actually in the world. So this idea of what employers could do to help support their employees around this area of sort of complex care and around the area of cancer came about for the Mayo Clinic really in a very organic way. There was a large national organization employer, one of the largest in the country, and they came to the Mayo Clinic and said that they were noticing great amount of variability within their organization, depending on where the patients happened to be nationally. So in different regions, there were different issues to do with cost, there were different issues to do with outcomes, and so they were looking for a way where they could say that no matter where their employees existed in the United States, they would be able to offer a consistency of healthcare, particularly around these serious and complex conditions. So we know that healthcare benefits per employee are increasing, and they're increasing at really an alarming rate. And what's interesting about this is that one of the things that's really pushing this increase in rates in terms of healthcare is actually around the focus of cancer. Now, we're doing better in terms of patient survivability in terms of cancer, and that's largely probably because of issues to do with early diagnosis and better treatments. But alarmingly, we're seeing an increase in the rates of cancer in people even as young as ages 15 to 39. And that's a trend that's been going on in the United States, and we're seeing a 23% increase now just since 2020. In addition to that, the drugs that are being used to treat these cancers are becoming increasingly more expensive, and particularly around this area to do with injectable therapies. Now, everybody worries about the issue with injectables, or what people think front of mind now are the GLP-1s, the ones that are being used for issues to do with weight loss, diabetes management, now recently FDA approved for sleep apnea. Those individual GLP-1s are actually not that expensive. It's more the issue around the volume of the GLP-1s that people are mostly concerned about. 7 of the most expensive injectable therapies are actually cancer therapies like Keytruda. And so it really becomes important that these therapies are being utilized the most appropriate time for the most appropriate patients. In addition, this issue of high-cost claims is increasing. So high-cost claims are basically $1 million that is utilized for healthcare claims for an individual patient. And the companies used to only face a handful of these, maybe in a large corporation each year. And now what we're seeing is a 50% increase in those high-cost claims patients, these patients that are costing organizations more than $1 million each, just over the last 4 years. That again is being largely driven around this issue to do with cancer. And so really what I want to talk to you about are some solutions around this issue to do with how to manage these patients with very complex care and serious conditions, utilizing things like centers of excellence. So increasingly, employers are turning to centers of excellence. We know that from surveys that have been done, that particularly around the area of cancer care, 50% of organizations are using centers of excellence around the area to do with cancer care by the end of 2025. And an additional 25%, so going up to 75%, will be utilizing cancer care modalities and programs to manage their patients with cancer and more complex and serious diseases. Why? Well, we know that these work. These centers of excellence actually work. And at Mayo Clinic, we call it our complex care program. And really, they work for people, and they work for employers and organizations. The way that our complex care program works, and there are many different variations of these centers of excellence, and you can access them. You can even access them through Mayo Clinic by going through other TPAs, by case managers, by other health partners, which help to manage patients to be able to move into more specialized consultative care. But you can also directly access Mayo Clinic through our complex care programs and pathways. It's not every patient that needs a center of excellence for their care. It's really these patients with more serious and complex conditions. Those patients, identifying the right patients, that then would be most benefited by leaving necessarily what they have for local providers, either for second opinions. And really then within our organization, what we focus on is providing the right diagnosis for these patients, providing then through our integrated multi-specialty care the right treatment for these patients so that it's executed and done in the right way. And we now have 11.1 million people who are connected with our complex care program. So these are some real numbers. It's one thing to say the right patient, the right diagnosis, the right treatment being executed correctly. But when we went back to 2023 and we looked at 7,000 patients who were brought into the complex care program, and we looked at what those programs really meant for outcomes in patients, this is what we found. And this is really the most important slide of this presentation. 52% of the patients who were referred to us for second opinions for serious and complex illnesses were actually, their diagnosis was changed during the process when they were undergoing their evaluation at the Mayo Clinic. And in changing that diagnosis then, 82% of the time that resulted in a change in the treatment for these patients. Sometimes that was a change in medical therapy, 57% of the time. Almost 25%, almost a quarter of the patients, 1 in 4, who comes to see us ends up not needing the surgery that was recommended at their local care facilities. So 52% of the time the diagnosis was changed, and in 25%, that was even something as significant as them not needing surgery. And we're able to do this because we bring together a group of physicians from multidisciplinary and multi-specialty who really put the patient at the center of what we're doing. And through that true integration, we're able to develop care pathways that are the right diagnosis, resulting in the right treatment. This is one specific patient, just to kind of give you a little more framework around this. So it was a patient that was referred to the complex care team and through the program through her employer. She was a person who had had lung cancer and was a lung cancer survivor. She was having difficulties with fatigue, she was getting more shortness of breath, she was having cough. And so her employer had referred her to the Mayo Clinic after she was seen locally, and her local physicians had said she had stage 4 recurrence of lung cancer, she needed a surgical resection, she needed chemotherapy, and likely radiation therapy as well. And through being offered the option of coming to Mayo Clinic through her complex care program, we revealed that she didn't have a recurrence of her cancer, that in fact actually what she had was a significant infection that required treatment only with steroids and with antibiotics. So her diagnosis was changed, her pathway to care was changed, she avoided the surgery that was recommended, she avoided the chemotherapy that was recommended, she avoided the radiation therapy that was recommended. So it was an enormous impact, as you can imagine, to both her and to her family. But in addition, the employer and her employer health care plan saved more than $200,000 in the first year that would have been required for her care of therapy. So it really can have a significant impact. So what does this program offer for you? Well, what this program offers is equitable access to your employees, no matter where they live in the United States. And it allows them definitive answers and path forward that lead to better outcomes. We're in the business of trying to remove any possible barriers that patients have to being able to seek our care and expertise. So whether that's through travel and lodging benefits that can be offered, whether it's issues to do with co-pays up front and other issues such as that, the average person who comes in through a complex care program will see 3 to 5 specialists. They'll see those 3 to 5 specialists and have their entire evaluation from their first appointment to their laboratory studies, to their diagnostic studies that need to be done, meeting with all the specialists, and leaving with a treatment plan within 3 to 5 days. Because we really have created a system that works towards efficiencies, because we know that people travel a great distance to come and see us, and they can't really spend a lot of time. They need to be able to accomplish this efficiently. And so finally, what I'd like to leave you with is 160 years ago, the Mayo brothers developed a single mission statement for the Mayo Clinic. And it's a mission statement that exists even today. And that is that the needs of the patient come first. The needs of the patient come first. Everything we do at the Mayo Clinic is about putting the patient at the center of everything. It's about focusing solutions and care and hope around what that patient needs and what we're going to be able to offer that patient. And that makes what I do very rewarding, because every day I get to help people that put their trust and faith into Mayo Clinic in terms of the management of their complex and serious care. So we have a table that's outside as well, and I'll be out there if anybody's interested in kind of understanding or hearing more. But I am very grateful for the opportunity to be able to speak with you all today and let you know a little bit more about how you can offer your employees access to the Mayo Clinic. Thank you.